Hello, my name is Sarah Gissinger, and I am a sophomore 2 in the BSN program at the University of San Francisco. I'm applying for the 4+1 program, specifically the Clinical Nurse Leader Masters of Science Nursing. I would like to take a few minutes to answer some of the questions presented in the application. Question 1. If you were a leader in healthcare, what changes would you make? As a leader in healthcare, my focus would be on the standardization of care, so that low-income, underinsured, or uninsured patients could access the same high quality of care as people of higher socioeconomic status. I have seen cases where, due to insurance status or inability to pay, patients are turned away or forced to wait weeks or even months to access the care that they need. Oftentimes, these patients are in pain and begin self-medicating to cope with their discomfort, usually leading to more severe medical problems and costly trips to the emergency department. I think that as a clinical nurse leader, it would be life-changing to work with some of these patient populations and find better ways to provide more timely, cost-effective services that would better suit the needs of these patients. While I understand that actualizing these changes takes years of healthcare reform, I believe that starting at a grassroots level is how we find solutions that could possibly address greater issues we face in healthcare on a broader level, such as cost and accessibility. Question 2. Why do you want a Master's of Science in Nursing as a clinical nurse leader? To err is human, but to remediate is divine, as I have been learning in my HESI study sessions. I want a Master's of Science in Nursing as a clinical nurse leader, so that I can develop the skills needed to coordinate customized client care with other allied healthcare professionals to help incorporate the latest technologies and innovations in treatment and close the gap between the care that we are giving and the care that we intend to give. Being able to incorporate evidence-based practice, anticipate risks, and improve safety and quality are passions of mine, as I want to advocate for patient populations experiencing disparities in care. As an advanced generalist, I would be able to work in various microsystems to provide social justice, increase functionality, and help improve accessibility by keeping costs down. Studying the role of the clinical nurse leader in depth would allow me to make a positive impact at the bedside and in clinical cohorts in general. Thank you so much for taking the time and consideration needed to review my application. And many thanks to the faculty at the University of San Francisco School of Nursing and Healthcare Professions for supporting us and providing so many options to continue to pursue further nursing education.